Go ahead and do this right now. Raise your arm up over your head. How high can it go before that dull, nagging pull drags it back down? If you felt it, you are not alone. Millions of seniors deal with exactly that restriction every single morning, and the frustrating truth is it is getting worse with every passing year. Not because something is permanently broken inside that shoulder, but because the one movement that can actually reverse the problem is almost never taught by a standard doctor, therapist, or fitness trainer. Here is what makes this even more alarming. Research has shown that more than 7 out of 10 older adults who handle shoulder pain the wrong way end up with lasting, permanent loss of movement within just 3 years. 3 years. That means the clock is already ticking. The wrong stretches, the wrong rest, the wrong approach, and what feels like a manageable ache today locks into a permanent limitation tomorrow. But that stops right here, right now. In this video, you are going to learn exactly how to identify what is really causing your shoulder pain and the specific movements designed to fix it, for good. But before we get into all of that, let me quickly introduce myself for anyone joining us for the first time. My name is Dr. Vanse, and I specialize in blending the best of Eastern and Western medicine to help seniors move better, age stronger, and stay fully independent. If this is the kind of content you want to see more of, practical, science-backed health guidance built specifically for people over 60, go ahead and hit that subscribe button right now and tap the bell icon so you never miss a new video. It truly means the world to us and helps this information reach the people who need it most. Welcome back to the Senior Health Podcast, where Eastern wisdom meets Western science to help you age with strength, freedom, and full independence. I am Dr. Vanse, and today we are tackling one of the most misunderstood problems I see in seniors: shoulder pain that just never seems to fully go away. Here is the thing most people get wrong. They treat all shoulder pain like it is the same thing. Same stretches, same rest, same anti-inflammatory medication, and then they wonder why nothing improves. The shoulder is actually the most mobile joint in the entire human body, and that extraordinary range of motion is precisely what makes it so easy to break down in very different, very specific ways. When a patient walks into my office and says their shoulder hurts, that tells me almost nothing useful. What I need to know is exactly where it hurts, exactly when it hurts, and exactly what movement triggers it. That information tells me everything. So here is what we are going to do today. Before we touch a single exercise, we are going to run 3 quick diagnostic tests together. These tests will help you identify which type of shoulder problem you are actually dealing with. As you go through each one, pay close attention to 2 things: where you feel the sensation, and whether that movement feels painful, weak, or both. That distinction matters enormously. One important note before we start: please work through all 3 tests before drawing any conclusions. Many people have more than one pattern happening at the same time, and jumping to a conclusion too early can send you in the wrong direction. Let us begin with the first test. This is called the side lift check. Let the arm on your affected side hang completely loose and relaxed by your side. Now slowly raise it straight out to the side, palm facing down, and go slowly. In the beginning of that movement, close to your body, it should feel relatively comfortable. But somewhere in the middle of that arc, you may feel a sharp catch, a pinch, or a deep ache that makes you want to stop and bring the arm back down. That middle zone is what we call the painful arc. Here is the part that surprises most people. If you push past that uncomfortable area, the pain often disappears again as the arm continues rising higher. Pain, then no pain. That specific pattern tells us something very precise. There is a narrow gap between the upper arm bone and the bone sitting on top of the shoulder. When the arm passes through that middle range, the soft tissue packed into that gap gets squeezed and compressed. That is the pinch you feel when you reach for something on a high shelf, pull on a jacket, or lift a bag off a counter. If you felt even a hint of that sensation, make a mental note of test 1. Now for test 2. This is called the empty can test. Hold your arm straight out in front of you, angled slightly outward, about halfway between pointing forward and pointing to the side. Now rotate your thumb downward, as if you are tilting a can to pour liquid out. From that position, use your opposite hand to press gently down on your wrist while you try to hold the arm up and resist that pressure. If you feel pain at the top or front of the shoulder, or if the arm feels surprisingly weak against even light pressure, that is a positive result. What does that tell us? It points directly to one specific muscle inside the rotator cuff called the supraspinatus. This muscle is the primary workhorse every time you first raise your arm. When it is irritated or weakened, everyday tasks start to feel difficult. Reaching a high shelf, washing your hair, pulling a shirt over your head. Most seniors assume the entire shoulder is failing when they feel this. But in the vast majority of cases, it comes down to this one muscle. And the encouraging news is that it responds extremely well to the right targeted approach. If you felt any discomfort during that movement, note test 2, and now test 3. This is the outward turn test. Bend the elbow to 90 degrees and keep it pressed firmly against your side. Now try to rotate your forearm outward, away from your stomach, pressing against a wall or door frame for resistance. If that causes pain on the outside or back of the shoulder, or if it feels noticeably weaker compared to the other side, you have found your third pattern. This one shows up constantly in people who experience pain while steering a car, pulling a door open, or reaching back for a seatbelt. Now take a moment and ask yourself one honest question. Which of those 3 tests felt most like the pain you live with every single day? That is your starting point. Do not try to tackle all 3 at once. Begin with the pattern that matches your real daily experience. Now, let us get into the exercises. We will cover all 3 groups in order, so I encourage you to stay with me through all of them, even if only one test applied to you. The movements for the other groups help protect the shoulder against the next problem before it ever starts. For the first group, targeting the painful arc from test 1, we begin with the pendulum swing. Find a sturdy table or the back of a solid chair at roughly waist height. Place the hand of your unaffected arm on it and lean forward slightly from the hip. Now let the sore arm hang straight down, completely relaxed. Do not engage any muscles in it. Let it hang heavy, like a rope dropping from the shoulder socket. Begin swinging it gently forward and back, small, lazy, easy swings, for about 30 seconds. Then switch to side for another 30 seconds. Then small clockwise circles, roughly the size of a dinner plate traced on the floor beneath you, for 30 seconds. Then counterclockwise for 30 seconds. The whole sequence takes about 2 minutes. Why does simply letting the arm hang help? Because when the arm hangs freely, gravity gently draws the upper arm bone downward and away from the bone sitting above it. That opens the exact compressed space where the pinch happens. You are decompressing the joint without lifting against gravity at all, which means the irritated structures finally get a rest instead of being loaded. Keep the swings small and relaxed. If you go too big or too fast, the shoulder muscles kick in to control the movement, and that defeats the entire purpose. The second exercise in this group is the table slide. Sit at a table with a small towel or cloth placed under your forearm, something that slides easily. Place the forearm of the sore side flat on the towel, palm facing down, elbow near your body. Now, slowly glide the towel forward along the table surface, letting the arm extend out in front of you until you feel a gentle stretch in the shoulder. The moment it starts to feel genuinely uncomfortable, stop, hold for a breath, and slowly return. Do 8 to 10 repetitions. The table is supporting the full weight of the arm throughout the entire movement. The irritated tissue does not have to work to hold anything up. You are simply asking the shoulder for a little more permission with each pass, not forcing the door open. The most common mistake is pushing too far too fast. More range does not mean faster healing. Forcing past the first real hint of discomfort only re-irritates what you are trying to calm. The third exercise is the shoulder blade squeeze. Sit tall in a chair, feet flat on the floor, both arms relaxed. Gently draw the shoulder blades in toward the spine and very slightly downward, as if you were tucking them into your back pockets. Do not shrug up. Do not arch the lower back. Simply hold that position for 5 seconds, then release slowly. 8 to 10 repetitions. This one may not look impressive, but please do not skip it. The way the shoulder blade moves directly controls how much open space exists in that pinch zone. When the shoulder blade sits correctly, the bone on top of the shoulder lifts slightly and the compressed space opens up. When it does not move well, the pinch zone stays tight no matter how much you stretch the arm itself. Many people begin noticing improvement in the side lift test within 1 to 2 weeks of doing this exercise consistently. Now for the second group, for those whose test 2 result felt most familiar. The supraspinatus is usually both irritated and weakened at the same time, and the instinct is to strengthen it aggressively right away. That is the mistake. We calm it first, and then build tolerance gradually. Start with the wall slide. Stand facing a wall, about 1 full step away. Place both forearms flat against the surface at roughly shoulder height, elbows bent. Now slowly slide both arms upward along the wall, keeping the forearms in full contact the entire time. Go as high as comfortable without forcing it, then slowly slide back down. 8 to 10 repetitions. The wall gives you constant support and feedback. The supraspinatus is being asked to engage, but inside a controlled range where it cannot be suddenly overloaded. If this is completely pain-free from the beginning, the muscle can tolerate that level of work, and you are ready to progress. If there is mild discomfort near the top, simply do not go that high. Find the range that feels challenging but not painful, and work there. The second exercise is the isometric press into the wall. Stand sideways next to a wall with the affected shoulder facing it. Bend the elbow to 90 degrees and keep it tucked firmly against your side. Now press the outside of the elbow gently into the wall as if trying to lift the arm outward, but the wall prevents any actual movement. Hold that press for 8 to 10 seconds, then release slowly. 5 repetitions total. Start at 30% of your maximum effort. That may feel like almost nothing, but that is exactly the point. After 3 to 5 days at 30% with no increase in pain, move to 50%. After another week, 60%. Never jump straight to maximum effort. Most shoulder setbacks in seniors happen because someone pushed too hard too soon. With the supraspinatus, patience beats intensity every single time. And now for the third group, targeting the external rotators identified in Test 3. Everything in daily modern life works against these muscles. Typing, driving, cooking, carrying bags. All of it pulls the arm inward, day after day, year after year. The outward rotators gradually weaken and tighten until one day they start sending pain signals. And because they are never specifically challenged in normal daily movement, they stay weak indefinitely unless someone deliberately addresses them. We start with mobility. The first exercise is assisted external rotation with a stick. Grab any light stick, a cane, a broom handle, a wooden dowel. Hold it with both hands in front of the body, both elbows bent to 90 degrees and tucked against the sides. Now use the healthy arm to gently push the stick across the body so the affected arm rotates outward away from the stomach. The elbow on the affected side stays pinned to the side the entire time. Only the forearm moves, rotating outward at the shoulder. Go only as far as comfortable, then return. 8 to 10 repetitions. 2 mistakes to avoid here. First, do not let the elbow drift away from your side. If it does, you have gone too far and other muscles are compensating. Second, do not twist your trunk to create extra range. The movement should be small, precise, and focused entirely at the shoulder. The good arm is guiding. The affected side is being carried through the motion, not forcing itself there. The strengthening exercise is isometric outward rotation into the wall. Stand with the affected shoulder toward a wall, elbow bent 90 degrees and tucked firmly against your body. Press the back of the wrist into the wall as if trying to rotate the forearm outward, but the wall stops all movement. Hold for 8 to 10 seconds, 5 repetitions. Again, begin at 30% effort and progress slowly over 2 weeks. The contact point is the back of the wrist against the wall, not the palm, and the elbow must remain against the body throughout. Now here is your plan for the next 7 days. Identify which test felt most like your real daily pain. Do only those corresponding exercises, once a day, every day, for 1 full week. Then retest the movement that originally hurt you. If it feels even slightly easier, that is real, measurable progress. If nothing has changed, slow down further, reduce your range of motion, and make absolutely sure you are not pushing into sharp pain at any point during the movements. Build the habit first, and the strength will follow. If this video finally gave you a clear path forward, a real plan instead of just more generic advice, please do us a huge favor and hit the like button. It helps more seniors just like you find this content. And if you have not subscribed yet, now is the perfect time. Hit that subscribe button and tap the bell icon so you get notified the moment we release a new video. We put out this kind of in-depth practical health content regularly, and we do not want you to miss a single episode. We also want to hear from you. Drop a comment below and tell us which test matched your pain the most. And if you have a topic you would love to see us cover in an upcoming video, leave your suggestion in the comments. We genuinely read every single one, and your ideas directly shape what we create next. Tell us what you want to learn, and we will make it happen. Thank you so much for spending this time with us today. Keep moving, keep showing up for yourself, and we will see you in the next one.